head, ears, eyes, nose, and throat checklist for assessment. So the first thing we did is we're in a private area, washed our hands, and we have good lighting. So we're going to start out with the head and face. First thing we're going to do with the head is we're going to inspect the scalp and head for step-offs or any signs of fractures or patterns of hair loss. And that looks good. Next thing we're going to do is inspect the face for symmetry and motion. And there's no facial droops with the mouth or drooping of the face in any way, so that looks good.
Nice.
And the eyes too. And the next thing we're going to look for is we're going to inspect for TMJ. So I'm just going to have open and close. So that's good. That feels good. And then next thing we're going to inspect the external eye. We're going to look at the eyelids real quick. So as it closes, looks good. No signs of dryness or any damage on the eyelids. And then now we're going to actually look at the sclera or white part of the eyes. And as we look at that, we can't see any bloodshot or anything, and so that looks good. And the next part, we're going to look at that membrane over the sclera, which is called the conjunctiva. And that looks good. There's no visible damage to that part of the eye. Also, the iris and pupil look good, so there's no damage there that we can see. Cornea appears intact. So next part we're going to take a look at is the covering and uncovering the eye, looking for eye drift. So the first thing we're going to do is actually cover the eye. As she looks at me, we're going to cover the right eye. And when I pull away the paper, the eye does not drift. Now we're going to do the other, actually this is the right eye. And as I pull away, the eye does not drift, so that looks good. Now we're going to move on to the eye ocular motions. So as the patient follows here, we're going to go cross and cross. Make sure our eyes are following good. Now we're going to do our X, down, up, and then finally down, up, and then again in the middle. Now we're going to check the pupils for constriction and accommodation. So we're going to go into the left eye, and that pupil constricts with light, and then now the right eye, and that pupil constricts with light. Now as she looks forward, I'm going to look in the right eye and see that constricts with light, and then the left as I flash into the right. So those both constrict too. Next thing we're going to do is inspect the ears. And as we look into as we feel the ears, we're going to feel for any damage or skin damage and look on the outsides of them too, and they appear to look good and intact. And now we're going to actually look inside the ears to see, to actually see the eardrum itself and make sure that's not damaged. So we're going to start with the left here. And that appears good. You can actually see the eardrum, which is gray. And now the right. Yep, and the eardrum appears intact on the right too, no visible damage. And the next part we're going to actually do is the hearing test. So as we use, or first thing, we're going to ask the patient if she can hear that.
Yep, I can.
And then now on the right ear, she can hear
Yeah.
that. And then now, as we put this on the ear, we're going to ask if she can hear this.
Yes, I hear it.
And then let me know when it finishes.
It's finished.
And then can you still hear this?
No?
Okay, we'll try one more time here. Let me know when that finishes.
Okay.
And now here.
Yes, I can hear it.
Okay, and then now we're going to do the same thing with the other side.
Who's in here?
There we go.
Yep, I hear it.
And now, you know
I
when
hear
that
it.
finishes?
Yes. Oh, that's neat.
Yeah. All right, and then now we're actually going to
Okay, nothing.
we're going to look into the sinus area, and we're going to check out the septum and make sure there's no deviation of the septum or no any visible damage at all in the nose. So as we look into the nose, looks good. Everything looks pretty clear. Very visible up to the top. Alright, now we're actually going to palpate around the nose to see if there's any pain or signs of discomfort.
Nope.
Nope. Okay. And then now we're going to move on to actually the mouth and throat.
Open my mouth.
So as we look into the mouth, we're just going to look for signs of mucosa, dentation, and the mouth looks pretty clean. Gingivitis, the floor of the mouth we're going to look at, which looks good. We're going to have her stick her tongue, now stick it up too. And now actually look underneath the tongue, so if you can lift your tongue up. Yep, that looks good. Now put the tongue out. Now say ah.
Ah.
Yep, that looks good. So that gives us a sign that there's a gag reflex. Now we're going to palpate the lymph nodes in front of the ear, which is the preauricular and postauricular behind the ear. Yep, we're feeling for signs of lymph nodes. And then now the occipital area. And now the submandibular area and submental area. So far, no lymph nodes. Now the anterior cervical chain, right here. And posterior cervical chain, we're going to feel there. So no lymph nodes there. Now supraclavicle here. No signs of lymph nodes there. Now we're actually going to palpate the thyroid here. And the trachea too for lymph nodes. Alright, and that concludes our head, eyes, ears, nose, and throat assessment. Thank you.